Good afternoon, everyone. Wynn Brown here with Heywood Healthcare's update for the week ending Friday, the 27th of August. Hard to believe that we're about to turn the corner into September. Some information to share with you and an update from my Wednesday midweek update, which was a special edition that I did just to give you an update on the surge of the coronavirus and the Delta variant in our region and how important it is that everybody pay attention to that. Right now, over the past 7 days, we have had 106 positive COVID-19 findings for people who are tested throughout our system. So that is a huge increase going on, and people need to pay attention to that. You need to be socially distanced, you need to wear your mask, you need to wash your hands. And most of all, you need to get vaccinated if you're not vaccinated. And I've been really nice about it in the past, but you need to get it done. There's science, there's evidence. You are crushing our health resources, not only in our valley, but across the Commonwealth and across the country. And you need to follow the science and the evidence, and people need to get vaccinated. And I would say to parents that you need to work with your kids and make sure that your kids get vaccinated if they're eligible, whether they're adults or teenagers. The majority of the people that we are seeing, the majority of the people in our hospital who are COVID positive are people between the ages of 20 and 50. It's not like the first surge. And they're not vaccinated. So this is real, this is important, and you need to work to make sure that everyone in your social circle and in your sphere of influence gets vaccinated, because it is putting an incredible strain on all of us, and especially our staff who are doing their best to provide the best care possible, but they're exhausted. And so you need to step up, you need to do your job, you need to support your community, you need to support our region and our country to make sure that we can get to that point where we have enough people vaccinated, and we need to get that done. We've mandated vaccines at Heywood Healthcare, and those everyone needs to be vaccinated by the end of next month. And so make sure that if you're on our staff that you are making sure you get that scheduled, and so that you can continue working as we head into October, because everyone who does not qualify for an exemption needs to be vaccinated by then. So stern talk, but it is what it is, folks, and we need to get it done. And we can be preventing almost all of this if people are vaccinated. So there's a chart here for everyone to see by town, so you can see the positivity rate. We have 7 inpatients right now at Heywood, many high flows going. Luckily, no vents right at this moment in time, but we expect that probably will be happening. And we have 2 patients under investigation, so we're awaiting their test results. So please pay heed to all of that. There has been some questions about the third vaccine coming out and everybody getting a booster. So there are 2 pieces to that. First are for those who are immunocompromised and qualify for a third shot. So that's considered a third shot for those who have immunocompromised systems. Then there is the booster for those of us who are not immunocompromised, and we expect that ruling will come out sometime in September, and it's recommended that you get a booster if you had your initial shot 8 months or more prior to getting your booster. So pay attention to that. There'll be more news coming out. You can get those vaccine boosters and third shots at local pharmacies, and you can get that done there. We will also have some level of clinics as well, yet to be determined, and all our staff can get their shots through employee health. So please take a look at all of that and pay attention to it. Flu vaccines are about to be coming out. Ours are on order. We have not got our shipment yet, but there is the recommendation is that we all try to get our flu vaccine in the next 3 weeks or so, starting in the next 3 weeks or so. We just don't have ours on hand yet, but you'll see more of that coming out, and we're waiting for our allotment from the state. For those of you working this weekend at Heywood Healthcare, we are short-staffed in our kitchen, and so for Saturday and Sunday nights, make sure I got that right. Saturday and Sunday nights, those working in the hospital, it'll only be the hot food line because we don't have anybody to run the register. So we are challenged with staffing across the board, as is every hospital and many of the businesses in our region. I encourage those of you who are looking for a job, or maybe have someone in your family looking for a job, to go to our website. We have a large number of openings, including non-clinical, door screeners in particular, security staff. Our minimum wage starts at $15 an hour at Heywood, so I encourage everybody to take a look at that. And if you're interested in being part of the Heywood team, the Heywood family, Heywood Strong, please come take a look at and consider doing that. For staff, just to remind everyone that we have our monthly recognition in Heywood Healthcare on the Heywood and Medical Group campuses for our Employee of the Month, and you can do that through the Heywood Care site and navigate that and look for our 2021 Service Star nominations. And on the Athol campus, we do that quarterly. So just some updates for all of you, but please, if you're not vaccinated, take the time, get vaccinated, and do what you can to support our community and remain safe, and wear your mask when you're inside if possible. Thank you very much as we continue our journey to be one of the best community-owned health systems in America. Have a great weekend.